January 6, 2020. Adequate notice of this regular meeting of the Kenilworth Board of Education has been provided to the Home News Tribune, the Star Ledger, the local source. A copy has been filed with the Kenilworth Borough Clerk, posted in the board office, the Kenilworth Borough Hall, Burley and Harding Schools, as is provided by the Open Public Meetings Act. This will be an in-person meeting. Due to an announcement by the Governor Murphy, participation will be limited to 25 individuals. The Board of Education therefore estimates that 12 members of the public will be able to participate in person. In an effort to encourage and increase public participation, the meeting will be live streamed, and the public will be able to view the live via YouTube stream. The link will be available at 7:30 p.m. by clicking on the Watch the Meeting Live icon on the Kenilworth District homepage. Public comment will be accepted only during the public comment period in person to public comments at kenilworthschools.com or by calling 908-931-9696 extension 2325. For the record, please include your name and address in all comment requests.
Okay, everyone please rise to the flag. I pledge allegiance. Roll call.
Biner. Here. Braun. David.
Here.
Drogan. Here. Habather. Here. Jankowitz. Here. Ladati. Panici. Here. Zimmerman.
Here.
We have quorum.
Okay, thank you. Our first item is the receiving of the minutes of the secretary from our October 13th meeting. Is there any modifications to the minutes? If not, we have a motion to approve the minutes. We have a motion by Dr. Panici. Would someone like to second? Second by Mr. Biner. All those in favor say aye. Aye. Anyone opposed? Okay, next up is reading and acceptance of our monthly correspondence. Mr. Ganell?
Yes, we have two items this evening. We have an email dated 10/20 from Justin Maranka to Kyle Arlington, recognizing teachers Yusilevich and Mrs. Harrison. We also have a press release distributed on 10/23 to the local source and Rena Media regarding last month's student spotlight. That concludes public correspondence.
Okay, thank you.
To accept the correspondence?
I'm sorry.
The motion to accept the correspondence?
Thank you. A motion made by Mrs. Zimmerman. Can I have a second? Second. All right, a second by Ms. Drogan. All those in favor say aye. 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 Anyone opposed? Okay. Next up is our superintendent's report and presentations. Mr. Arnold.
Good evening. To introduce our spotlighted students tonight, I'm pleased to welcome Mr. Davies to our meeting to share more. Mr. Davies?
Hi, good evening, everybody. Just want to first of all say thank you for the opportunity in this environment of coronavirus. You can get so bogged down in all sorts of things related to that, and it's great to take a moment and recognize some of the really good work that is going on here at David Brearley. And we have two students that we're recognizing tonight. Before I introduce them and speak briefly about those two students, just a note that it is so, I think, difficult to be a student these days. It's so tough. It's tough to be a student on a normal day. But it's even more tough to be a student in this environment. And so kudos to these two youngsters from our middle school who have kind of risen above all of the stuff that's going on and have demonstrated to their teachers and to us administrators that they really care about their studies and they're elevating the rest of their peers. So I just want to start off by saying that kudos to our two students. The two students that we're recognizing tonight are both David Brearley middle schoolers. And our first student is Samantha DeMatos. David Brearley's September Middle School Student of the Month is our 8th grader, Samantha DeMatos. The middle school staff recognized her in September for her hard work, her determination to succeed, and her positive outlook even when she faces obstacles. Samantha was part of the middle school student council last year where she assisted in fundraising promoting school spirit and representing her classmates. This year, Samantha was recently published in the most recent edition of the middle school newspaper. She did a human interest piece on Sarah Winchester and her mystery house in San Jose, California. You taught me a lot in that article, so I really appreciated that, and now you made me want to visit San Jose. So congratulations goes to Samantha Tomatos and our September Middle School Student of the Month for David Brearley. Samantha, I have a certificate for you, if you don't mind. I think we can. Walking on up here.
Congratulations.
Socially distanced photo.
And our second David Brearley Middle School recognition goes to Carter Stein. Carter Stein is the October Middle School Student of the Month, and he is a 7th grader here at David Brearley. So also just a kudos to Carter for rising above the coronavirus and demonstrating again to us educators that he really cares about being a student here. And that's just wonderful to see him taking his studies seriously. Carter's teachers report that he always has a positive outlook and he's so eager to learn. Carter goes out of his way to help his classmates. He is kind. He is thoughtful towards others. His hard work in all of his classes, and he takes pride in being a well-rounded student. Carter's known to have his schoolwork held up by his teachers as an exemplar, which happened the other day in art class. Congratulations, Carter, for being named the October David Brearley Middle School Student of the Month. Come on, Cole. So again, just to reiterate how special it is, I think both Carter and Samantha, congratulations to you again. These first 2 months of school in 2020 have been really interesting and different, and just keep it up and keep pushing yourselves to be excellent students. You've really made an impression upon the teachers and your peers here at David Brearley, and I look forward to working with you a lot over the next several years because we have much time together. So thank you, and thank you to the board for your time. Appreciate it.
Did you want to get a
Want to get a
picture?
picture?
Sure, I saw you kind of pull it out.
Oh, absolutely. I love pictures.
Social distancing and everything, realize we're still using,
Tony could go now. Tony could go now.
Thank you.
Thanks, Jerry.
Next up, we have a presentation from our benefits advisors from Brown & Brown. Mr. Sardella will come up and talk about Chapter 78 and Chapter 44 and how it will affect our staff and as well as the Board of Education. We're going to keep it on a very high level this evening. It does have some impacts on, as I said, our staff as well as our budget. So we're just going to keep it on a higher level so we all at least start understanding what the process is all about, how it can impact us, and obviously when we get into both the budget and negotiations, we'll be getting into a deeper dive into these topics. So Tony, you want to come up and got your presentation? You can go up there. I'll just give you this. Can you see the screen from there? Let's see if you can see it.
From up there, I don't think so.
I might have to. There you go. So what I'll do is I will tilt this a little bit.
Need help with Yeah, it's good, Vincent. Good?
Yep.
Yep, good job.
Let me straighten that out a little bit for you, though.
Thank you.
All right.
Good evening, everybody. My name is Tony Ciardella. I am the Senior Vice President for Brown & Brown. We are by far the largest public sector broker in New Jersey. We currently have approximately 350 school board clients in the state, which is well over half of all school boards. Tonight, I'm here to give a general overview of a recent law that was passed. Governor Murphy signed New Jersey Chapter 44 law on July 1st, and it does have an impact on the district. And basically, I'm going to go over what the Chapter 44 is, what it does, and just generally how it impacts the district, along with the open enrollment that is scheduled for January 1st for your employees here, and their ability to either go into that plan or remain in the plan that they're on right now. Disclaimer, always have to do our disclaimer. Basically, we are insurance brokers and consultants. We are not attorneys. So the information contained in this presentation is not considered legal advice, and it should always consult your board attorney for a definitive legal opinion of any kind of state or federal legislation. The other thing is Brown & Brown neither warrants nor guarantees any estimates of the financial impact of this legislation on any client or non-client school district. So now that we got that out of the way. Okay, so we talked about the disclaimer. Legislative update, again, an impact on the School Employees Health Benefits Program, or the SEHBP for short, and an impact on privately insured school districts such as Kenilworth Board of Ed, who is currently insured with Aetna. We're going to talk about the affirmative selection process, which is part of the January 1st, 2021 employee open enrollment. We're going to talk about how the benefits that you have existing with Aetna right now compare to New Jersey Educators Health Program and the administrative considerations going forward for the Board of Education. And please stop me at any time during this if a question pops up. Okay. As a non-SEHBP district like Kenilworth, again insured through Aetna, you are allowed to keep your locally bargained plans. The employee benefit contributions for all existing plans will be based on Chapter 78, which is a percentage of plan premium, or a locally negotiated amount, including employee contributions on dental and vision. So no change on your existing plans. The rates are not changing for January, the benefits are not changing for January, nor are the employee contributions changing for January. Your renewal date with Aetna, when those things will change, will be July 1st of 2021. But in the meantime, pursuant to Chapter 44 law, the district is required to offer the New Jersey Educators Health Plan. We'd like to refer to it as just the EHP for brevity purposes. Must be offered during open enrollment, which is going on right now at the district, to be effective 1/1/21. The employee benefit contributions, and this is important, are based on a percentage of salary instead of the existing Chapter 78 percentage of plan premium. Now, what does this mean to the district? This means that there's a total change in every employee that enrolls into this new EHP program is going to be getting off of Chapter 78 contributions and getting into Chapter 44. Now, we've done a number of different analysis in my firm, and the Chapter 44 contributions, which were spurred on by the NJEA in part, are much less expensive for the employees on a contribution basis than Chapter 78. So it has to be weighed that the plan is less expensive than your PPO plan, where most of your employees are currently enrolled. However, the loss of employee contributions may or may not be greater than the lower premium offered by the new plan. And that's something that Vincent and I will have to get together on once all the applications are in from the open enrollment, and determine how many people went into the new EHP program, what the loss in contributions are for those people who went and now are on Chapter 44 rather than Chapter 78, compared to what the premium difference is for that lesser plan. Now, going further, the Garden State Health Plan is going to be offered pursuant to Chapter 44 again, as of 7/1/21. The employee percentage of salary benefit contribution is expected to be about half of the EHP program. Now, the plan summary is not yet available, but the rumor is, and from well-educated sources throughout the state insurance marketplace, that the benefits are rumored to mirror the EHP program that's going to be offered as of 1/1. Only with a New Jersey only provider network to help reduce costs. Now, the pricing is not yet available, so we don't know where that's going to come in comparison to the new EHP, nor your current PPO plan, where again, the majority of people are enrolled. So we're gonna look out for that come July, but right now it's the EHP that we're concentrating on. Just some interesting facts that were part of Chapter 44. It was decided through the law that all employees hired on or after 7/1/2020 must enroll in the new EHP plan effective 1/1/21. So those employees have no choice. So of the 5 plans offered by the district, they have to enroll in the new EHP program. They cannot enroll in any of the existing programs. Now, the EHP and the future GSHP, or Garden State Health Plan, which will be effective again 7/1/21, will be the only plans offered to new hires until 1/1/28. And again, that's part of Chapter 78 law, where it kind of sunsets as far as new employees go on 1/1/28. From then on, we don't know. That's a long time from now. But also, and the last point on there is pre-Medicare retirees, both current and future, will be enrolled in the EHP beginning 1/1/21. And once the Garden State Health Plan, or GSHP, is available, the understanding is that will be also available to pre-Medicare retirees. So it's not just active employees this is affecting also pre-Medicare retirees. Okay. The affirmative selection process, this has become a big deal among employees in the school board marketplace. It is required for all New Jersey boards of ed. Current plan enrollments, for the first time since I can remember, and I've been doing this as a broker for 26 years, that your enrollments are not carrying over to the next year. That you must actively either re-enroll in your current plan, you can continue waiving coverage if you're waiving it right now, or you could switch to the new EHP program. Those are your 3 options as of January 1st. Now, the school district at Kenilworth has typically always had a 7/1 open enrollment, July 1st, which matches up to the renewal date. And we typically do that in May. Well, at that renewal, at that open enrollment, that's called a special affirmative enrollment, employees hired prior to 7/1/2020 will have the options of continuing enrollment in their current plan, switching to the EHP or Garden State Health Plan if it's available by May's open enrollment, or enrolling in any existing plan for which they are eligible under their bargaining contract, or waiving the district's coverage. However, employees hired 7/1/2020 or after have the options of continuing enrollment in the EHP, switching to the GSHP or Garden State Health Plan if it is available when we do the open enrollment in May, or waiving the district's coverage. So as you can see, Chapter 44 has really separated the newly hired employees, 7/1/2020 or later, from what they call non-newly hired or prior to 7/1/2020. So they've kind of split that, and they are getting, with the reason being, the legislation's trying to get enrollment growing steadily in the EHP and then the GSHP programs, because again, they're much less expensive, and they're both have been heavily supported by the NJEA, because since the 2011 implementation of Chapter 78, the NJEA has been promising the local unions and their employees that they will get rid of Chapter 78. Well, they have partially succeeded in doing so, but in return for that, you have to enroll in the EHP low-cost program or the even lower-cost GSHP, and there are some givebacks for doing such benefit-wise. Now, I'm not going to go through every one of this benefit grid, but if you look all the way to the left, you'll see your PPO 15 plan as opposed to the New Jersey Educators Health Plan. And where are the big differences? Number one is the out-of-network coinsurance halfway down. You'll see 80% for your PPO 15 plan. It's 70% for the NJEHP, but that's not the real difference. The real difference is down below, which I could sure you cannot see it, so I will read it. Basically, all of Kenilworth's existing Aetna health plans utilize the Fair Health Schedule to determine the out-of-network reimbursements for reasonable and customary. And Fair Health is the highest reimbursement you can get for out-of-network allowances. And that applies to the PPO as well as every other plan that Aetna offers with out-of-network benefits other than the EHP. Now, Chapter 44 mandated that the EHP program out-of-network benefits, the reasonable and customary allowance, would be based on 200% of Medicare. Now, to put this in perspective, 200% of Medicare is anywhere from a quarter to a half of the current Fair Health allowance. So looking at, say, a $30,000 out-of-network surgery, and Fair Health would typically pay all of that to the surgeon. I go in for knee surgery, it's out-of-network, it's $30,000. Well, Fair Health under your PPO would typically pay all of that. However, the Educators Health Plan would pay anywhere from a quarter to a half of that. So let's say it pays $12,000 for argument's sake to kind of keep it in the middle. The provider, because he or she is out of network, can then turn around and balance bill that member for, say, $18,000, the difference between the $12,000 allowance at 200% of Medicare and the $30,000 charge. So that's one huge financial pitfall that when I explained to the employees about who either have to take it or want to take it, because their premium contributions are gonna be less, that they need to be careful that they're staying in network, because if you go out of network in this program, you are going to be hit with significant balance bills from out-of-network providers. Now, the second big item that comes up at every meeting is the prescription drug program. Right now, you have, your PPO plan has 20% co-insurance, which means if a drug costs, say, I don't know, $80, you pay $16. If a drug costs $100, you pay $20. Well, under the EHP program, it looks good because it's a copay plan. So you have $5 for generic drugs, $10 for preferred brand drugs, and $10 for non-preferred brand drugs. Now, people ask, well, what's a non-preferred brand drug? It's usually, 9 times out of 10, the newest, greatest thing on the marketplace, which is also the most expensive. So from an insurance carrier standpoint, it's non-preferred. If a person, a member, an employee, chooses, or his or her doctor chooses for them a non-preferred drug, because that doctor, again, likes to prescribe the newest, the greatest drug in the marketplace, which is also usually the most expensive, and there's a generic equivalent available, the person not only has to pay the higher brand copay, they also have to pay the full dollar cost difference between the generic drug and the non-preferred brands. Now, to put this in perspective, my stepdaughter, unfortunately, has a seizure disorder. She's epileptic, and her neurologist, whom she's been going to since she was 4, she's now 21, and not about to switch neurologists, will not write anything but non-preferred drugs. Will not write generics, does not believe in generics, does not believe in older brand name drugs, and her drug times 4, because she's taking 4, all are in excess of $1,000 each, because they're all new, they're all non-preferred, they all have generic equivalents, and I'll just average it out. They average about $200 a piece. So if I were in this plan, and it's an extreme example, I realize, I'd be paying $800 per drug, the difference between $200 generic and $1,000 non-preferred brand, $800 per drug times 4 per month. So I would be paying out of my pocket $3,200 a month just to ensure that my stepdaughter gets the non-preferred drugs that her neurologist insists upon her having. And in the mail order, it's the same thing. The generic is $10, the $20 for preferred brand, and $20 for non-preferred brand. But again, if a generic equivalent is available, and you or your doctor choose the non-preferred brand drug, you will pay the full cost difference between the two. So those are the two big financial pitfalls that when I do a presentation, I make sure that I am not bad-mouthing the plan. I am purely making people aware of the potential financial pitfalls in order to protect themselves, because the few $1,000s that they may save going from Chapter 78 to Chapter 44 and going into EHP could be easily erased with one out-of-network surgery or high-cost service or a high-cost prescription drug over a couple months when there's a generic equivalent that could easily erase whatever savings they get from the contributions. So it's up to each employee. They have to weigh out their financial situation as well as their benefit needs for themselves and their family. But it is an important point for just general knowledge of what's going on with this new plan and where the loopholes are and where that plan's able to be cheaper than your current PPO plan. And it's those two areas which makes it cheaper than your PPO plan that you have right now. Administrative considerations for the BOE. Savings that emerge must be used to offset local property taxes unless the district is spending below adequacy. So that is something embedded in the law. So you must, any savings must be used to offset local property taxes. You cannot keep the savings unless you are spending below adequacy. The second is an actuarial certification is required by year-end 2023 that the net annual savings by implementing this new EHP program and then the GSHP and the corresponding percentage of salary contributions for those both plans have achieved at least equal to $300 million in the school board marketplace in New Jersey. So if the savings by the end of calendar year 2023, the net annual savings does not equal at least 300 million, the Chapter 44 retains the right to either up the contributions to get the savings to where it needs to be, or to lessen the benefits to the point where that savings gets to be at least $300 million. So the benefits and the percentage contributions of salary that you see today may not be the same by and I'll read it. With regard to employers that have collective negotiation agreements in effect that include health care benefits coverage, when the net cost to the employer is lower than the cost to the employer of the EHP, the employer and the majority representative shall engage in collective negotiations over the financial impact of the difference. What does this mean? This means that if the district is going to lose money by having this new EHP plan, if the rate decrement for that plan compared to your PPO does not make up for the loss in employee contributions going from Chapter 78 to Chapter 44, then the board shall negotiate with the majority representative union in collective negotiations over the financial impact of the difference. Now, here comes the funky part. It doesn't say when it's got to be done. It doesn't say how it's going to be done. And it doesn't say if the union just says, well, we're not in agreement and we're not going to accept any type of proposal and we're going to keep our EHP program, we're going to keep our Chapter 44 percentage of salary contributions. So whatever you, Board of Education, put on the table, we're not going to take. So that's where it gets to be a sticking point because it's not further addressed in Chapter 44. So I fully expect that there will be some follow-up legislation that will address this very issue of Section 8. Because right now, it's open-ended. It's just saying that basically, if the district is taking a loss on this program because of the lower contributions, you shall negotiate. Doesn't say when, doesn't say how, doesn't say that it has to come to fruition. It's just saying you have to negotiate, which is obviously vague and is not going to be to the advantage of the Board of Education. Because if the union is paying less and getting benefits that they're either happy with or are satisfied with, there's no way they're going to agree to negotiate in good faith. So we expect to see follow-up legislation, and when that occurs, I will certainly let Vincent know, as I always do, whenever there is new legislation floating around, and we'll take it from there. But that's where we stand right now. Anyone have any questions regarding this Chapter 44, the open enrollment process, or anything else? This was a very general meeting. Visit asked me to keep it general. We're really not gonna know the financials until Vincent able to go through all of the applications that come in, and we can determine how many people actually took the EHP program and what the contribution was for those, say it's 30 people. What was the board getting in contributions for those 30 people under Chapter 78, and what are they getting now under Chapter 44 and versus what were we getting in rates or premiums? What were we paying in premiums to Aetna for the PPO, and now what are we paying them for the EHP program? And that's how you get to the net number. You compare what you're paying in premium versus what you're getting back in contributions, which we're not gonna, again, know till December, until all the employee applications are counted and all the numbers can be run, and I'll certainly help Vincent any way I can with determining that loss, gain, or break even, whatever it shall be. So, anything from anybody?
Yeah, Tony, I have
Yes.
a question. So you said open enrollment is going on now, correct?
Yes.
So, and anybody who is hired after July 1st is required to go into this new plan?
Yes.
So, not financially, Vince, but do we know how many staff members that were hired after July 1st and will be mandated to go into this? Just rough, I mean,
I think there's only like 4 or 5.
Okay.
So that won't be the significant piece. You know, if you were following along with Tony was talking about, to me, the significant piece is going to be the challenge of figuring out what our expenditures are going to be and what our revenues are going to be for next fiscal year.
Right.
Obviously, this year's, any changes that happen on July 1st, January 1st, I'm sorry, we'll have to deal with. But there are going to be next July 2 additional plans, so we'll have a total of 6 plans.
Right.
We started to see a small trend of people leaving either the PPO or the POS and moving to the high deductible plan, which was a positive thing, I think, for both our employees and the Board of Education. Lesser premium for us, lesser Chapter 78 contributions for them. So that we're seeing some type of relief in that area to begin with. Whether now these people take advantage of the new plans, the one that takes effect, the New Jersey Educational Health Plan that takes effect in January, or the Garden State Plan that takes effect in July, that needs to be, played out. My concern is people moving from the PPO to the high deductible plan. It was essentially the same benefit structure. How you paid your deductible was different, but the benefits behind it was essentially the same. My fear here is that they're used to having that similar benefit structure in all our 4 current plans, whether even the EPO and the PPO, the POS, the EPO, and the high deductible plan, all essentially have the same benefit structure. It's just your little nuances with how you pay deductibles. My concern is the radical difference in the employee health plan, both the prescription piece and the fair health schedule are 2 significant things that I don't know if our employees are going to see, and I just hope they just don't jump at it and say, oh, look, I could save X and not get bitten in the end.
Right.
The
So
good
that
news.
was going to lead into my next question,
Yeah.
which is, out of the people who've already enrolled, is anybody selecting?
Well, we're starting the enrollment
Hasn't
period. Actually,
officially started
Tony's
yet.
going to do a presentation for our staff on Wednesday via Zoom, that we're going to really roll it out, and then finish it off for the rest of this month.
And very comprehensive when it comes to letting them know what the positive as far as the employee contributions, but more so the potential financial pitfalls that they can fall into that could easily erase any kind of savings. And, I'm very adamant about explaining that I'm not here to badmouth the plan. I'm here to make sure the employees of the district that I represent are protected from this program because, in my opinion, the NJA and the law itself did not really come forward, if you will, with pointing out these potential negative impacts financially on the people that take the program, which I certainly do, and, you know, it's my job to protect your employees, and that's, you know, a big part of the presentation, is answering those questions, because we do get a lot of them. I've done probably at least 20 of presentations in the last month, via Zoom or whatever the district used, and I'm seeing about 20% or so enrollment, and that's a lot of that is because I take the time to go over the potentially negative portions of the plan with regard to the benefits, instead of kind of smoothing over that, which I think the NJA does. And in fact, you know, I think that's kept at 20%, whereas if you go to, I was speaking to a representative from the SEHBP, the State Health Benefits Program, and they're stating that they're at about 60% enrollment in the EHP program, because they don't talk about the negatives. They want everyone in there because the NJA is basically running that, and they don't really discuss it, they don't go into detail, and if you don't do that, then it seems like an easy choice, but it's not.
Do you know, is the in-network strong?
The in-network strong, it's not, definitely not a problem with the in-network. It's
Okay.
on par, if you will, with your PPO plan. It's really the out-of-network and the
Yeah, that's why I
prescription.
asked the question.
Yeah, no, you're right on. It's strong enough in network. So what I say to people are basically, if you are disciplined and you could stay in network whenever possible, of course, and you're disciplined enough to take generic drugs or take preferred brand drugs and stay away from non-preferred drugs when there's a generic equivalent available, you can make this plan work for you.
Right.
However, you never know what's gonna happen tomorrow. You never know when you're gonna have to go out of network because the surgeon you wanna go to, who's the best, is out of network. And next thing you know, you have heart surgery and it's $100,000 bill, and, you know, Fair Health under the PPO would have paid the whole thing, but now you're only getting $45,000, and then you're getting a bill for $55,000 for the remainder from the surgeon.
Okay, thank you.
Okay?
Yep.
Would it be
Everyone,
fair?
thank you.
I got one quick question.
Oh, sure.
That's it. Is it fair to say by forcing the new employees into the new plan, that long-term, the current employees, they're gonna retire, so then eventually we'll have all new employees
Correct.
in the new plan, which ultimately means we're gonna be saving money? Is that pretty much
Not,
the general?
well,
If the plan lives that long.
two points there. Depends on what the difference between Chapter 78 and Chapter 44 contributions are. So currently, we're getting, if everyone were to move to the Chapter 44, the new plan, we would lose significant amount of revenue through the Chapter 78.
All right.
Okay, so the premium is 8.5% difference, 8.8% difference. The question is, would we be able to make up that difference in revenue? I don't think so if you were to do it completely. But you're absolutely right. Moving forward through attrition, you will see everyone moving towards that model. But if that's the case, then most districts are going to probably migrate to the state employee health benefits plan, because then it's just one thing, you might as well. But then there's that caveat that the NJA basically controls what the level of benefits are. So you might.
It's been hinted at on more than one occasion that the SEHBP, or State Health Benefits Program, has two other plans which are very rich, equal to about your PPO plan, called NJ Direct 10 and NJ Direct 15, one has a $10 copay, one has a $15 copay, that those plans will be gone as soon as there's enough enrollment in the EHP and the GSP program, that those plans will eventually be just erased, they'll be taken out.
Well-
And then they'll get all these people back into the SEHBP, and then they won't have the more expensive and richer benefit programs if they have medical conditions, et cetera, and they'll be stuck with the EHP program and the even, less expensive and less rich GSHP with a New Jersey only network, which means that if you happen to be in New York and you get sick or something happens, you have no benefits out of state unless it's a life-threatening medical emergency.
Yeah, we could get into the philosophy of it, but you could also look at it this way, that they're eliminating the two richer plans because they're Chapter 78 based, okay? To leave only the Chapter 44 based one, and there's nothing stopping them in the future from, once those two Chapter 78 plans are gone, to elevate the level of benefits in the current, either in the current NJEHP plan.
Right.
Right, I mean, that would have to be.
To kind of like mirror what the Direct 10 is, because they have the number of votes on that commission to do so.
Right.
And now it's based on Chapter 44 contribution levels, not Chapter 78 contributions, but they're replicating the same plans. So,
Right.
philosophical discussion for
Yeah.
5-10 years down the road.
Chapter 44 does mandate that the NJ Direct 10 and 15 have to be, so until that sunsets,
Right.
those programs have to be in there, but I think you're right, Vincent. Long-term, that would be the play for the NJEA and for the SEHBP Commission to get rid of the Chapter 78 plans, and then they could do what they want with the remaining lesser cost programs. Okay.
Thank you, sir.
Thank you very
Thank
much.
you, Tony.
Good seeing everybody.
Same here.
Have a good night.
Please enter the extension of the person you are trying to reach, or enter your personal ID. For a dial-by-name staff directory, press 555.
I'm going to ask that request.
All right. Good evening. As you know, New Jersey districts are required to complete a yearly self-assessment to determine grades under our state's harassment, intimidation, and bullying law. Tonight's brief presentation is in fulfillment of the annual requirements to publicly present that information. Vince, do you mind just hitting it forward? There's only 2 or 3 slides. Sorry. Hit exit maybe first.
There you go.
Actually, this is working now. So. By way of background, there are 8 core elements that each school self-assesses. They're related to our HIB programs, policies, trainings, curriculum and instruction, personnel, and reporting procedures. In each of the core element areas, there are then sub-indicators. In total, there are 26 sub-indicators. In each, we self-report on a continuum of 0 to 3. A determination of 2 meets and 3 exceeds requirements. So obviously, we're striving for all 2s and 3s across the indicators. Our anti-bullying coordinator and anti-bullying specialists, counselors, and other stakeholders come together to complete the assessment that we then use as a mechanism for growth. At this time, the results are embargoed, meaning the specifics are not made public until the board has the opportunity to review tonight's presentation and the state reviews and approves our self-assessment. We then post our scores in each of the sub-indicators on our website. So tonight, the board has the broad data in front of them via those three supporting documents in the folder. And I'm sharing here a high-level overview. Here's where we excel. Frequent communication between administrators and teachers as it relates to HIV matters. We've had an increase in the number of professional learning trainings, and we're planning for more. The implementation of Second Step in grades K-7 allows for a systematic approach to social emotional learning and HIV prevention. These efforts are supplemented by additional singular efforts like Week of Respect and the National Start with Hello program. And finally, our tracking and compliance tool, Hipster, helps with record keeping. Moving forward, these were areas on which we need to focus, most of which deal with providing students with explicit instruction, particularly in the middle and high school grades, on both our HIV policies and larger learnings around what constitutes HIV. As I shared with the curriculum committee in the spring, and just now actually, several HIV appeal hearings from last spring shone a spotlight on these needs. Sort of in conclusion, here are some general takeaways. Our increased focus on social emotional learning matters. We need to celebrate those efforts, but also expand and build upon them. Our commitment to professional learning to stay current and sharp underscores what we value and that we want to continue to grow in this area. Mr. Gagliardi's office has provided many of those trainings to us over the past year. Finally, the self-assessment scores reveal a good place to start the work that needs to be done by providing explicit, as I mentioned earlier, teaching and HIV policies and procedures for students. Students need to know there is an HIV criteria, that engaging in an act of HIV does not mean you're a bully, it means you engage in an act of HIV that meets the statutory criteria. Students need to know the impact of an act of HIV matters more than their intent. That is, whether you agree or not, there's no place for seemingly, innocuous, good-natured teasing. We'll be digging further into these results over this school year, particularly with the advent of new building principles. But Mr. David, I'm happy to answer questions now.
Does any board member have any questions for Mr. Arlington?
This is a self-assessment. I noticed that 7-year comparison was, I don't know if it's significantly lower, or we're assessing ourselves significantly lower than previous years. Am I looking at this the right way? Or?
Yeah, so each indicator is assessed on a yearly basis. So suppose we offered like more robust professional learning for the anti-bullying specialists in 1 year than we did this past year, we would score lower.
Yeah, it looks like training is
Yeah.
the
Mm-hmm. Yeah, so it's not guaranteed that you score the same every year or get better.
Any other questions for Mr. Arlington? Okay.
Thank you. I just have one more item. I want to alert our school community, whether in person or at home, that tomorrow we'll be pushing out revised guidance from our school's medical team. The guidance is reflective of lessons learned from our first 2 months in school. It also aligns to changing guidance we're getting as a result of the CDC adjusting its definition of close contact, along with updated thinking and protocols from the Kenilworth Health Department, the Union County Health Office, and our school physician. The guidance tweaks our responses to such matters as how we deal with a student who tests positive for COVID, protocols for individuals considered close to contacts, and how we're distinguishing moving forward isolation from quarantine and other critical information. So I ask that everyone be on the lookout for that information coming tomorrow. It's so important that I'm going to highlight some reminders right now to everyone in our school community. One, stay home if you are sick. Stay home if you've taken a COVID test and the results are pending. In both of these cases, stay connected with our school nurses. Let them know. We'll help you and support you. With this in mind, on the weekends and holidays, please email our nurses, our building principals, or me. This seems like the best way to get in touch on these days rather than phone calls. And finally, if you're traveling to a high-risk area, as we've been messaging out weekly, we will expect you to quarantine in accordance with our health guidelines. So again, all of this information and more that's been revised will be sent tomorrow.
Any questions or comments on that?
As more people are getting tested, it's taking longer to get those results. You can wait weeks. So, example, I was coughing a lot, felt sick, and then it was 100.1. This is months ago. Well, the doctor offered to go for the COVID test. Luckily, I had it back in 3 days. Symptoms went away because it was an allergy, but we get so scared now because as soon as you cough and one other little thing, you think, oh my God, I must have it. But if they're going to wait, if they're getting it and their symptoms go away and they've gotten tested, it can take 2-3 weeks to get these test results as it gets worse. Or are you talking about the 24-hour one, which really isn't?
Yeah, so we learned today from the health department that you don't necessarily need a negative test to return to school. You need to have quarantine for the 14 days from the onset of symptoms or 2 days prior to getting the test.
Okay,
Because you could not be shedding the virus but still test positive. And that's something we just learned today, which is in part why we will be reissuing guidance tomorrow.
Another thing, like I know everyone here has to wear masks, and the teachers have to wear masks, and the students have to wear masks. And is there a procedure or repercussions to teachers that aren't enforcing that, or are they all?
So far, we've had very few. The answer to that is yes, but we've had very few mask issues. I believe Mr. Davies told me a couple weeks ago. At that time, we only had 1 or 2 issues, so it hasn't been a widespread challenge.
I know they understand there'll be repercussions if they're not following protocol.
Sure.
Any other questions on that?
I'm interested, if a person is sick, a teacher, and they have to stay home, and they probably got it here, are they using their sick time, or we should be paying their sick? What's the procedure? Do we pay their salary because they're quarantined, or do they have to use their sick time?
That's very, very complicated. I may defer to Mr. Gagliardi, but it's like case specific, right? So there's FCCRA regulations, right? They have to use that first, but they can use 10 days of paid sick leave before that kicks in. But
Yeah, so there are, under the FCRA, there are very specific reasons that an employee can give where they wouldn't have to use any of their days, in terms of them being exposed here, in terms of them having to care for a family member, in terms of them having to care for a child because their child's primary source of daycare or school is closed, specifically closed because of COVID. So there's a list in the law, which has been modified and probably will be again, where the person would have to use their sick days. There are certain things in some guidelines that have been put out where the person would absolutely have to use their sick days. For example, if they specifically went to an area on the list of states, I think we're up to about 72 states now that you can't travel to without having to face the 14-day quarantine. So if they choose to travel there,
Except
they
New
don't
Jersey
get
and
to
New
use
York.
their sick days unless they're sick. So they're making a decision that would put you in a position where this person's going to wind up with 2 weeks unpaid. Then there's middle ground, which I don't think has been addressed. So suppose the employee doesn't travel out of state, but the person with whom they live travels out of state and comes back. And I think we're going to see a whole lot of this with the holidays, as you might imagine. Or the person is here and is coming to work, but somebody from one of the 72 states comes and stays with them, right? The CDC doesn't answer that. The FFCRA doesn't answer that. Your collective bargaining agreement, of course, doesn't account for that. What are you going to do? I don't know that some of these issues have been addressed in internal discussions, and of course I'm not going to discuss them publicly, but I will simply say this. For those in the gray area, as a public body, there's a host of cases that have nothing to do with COVID, which simply says that as a public body, you are obligated to treat similarly situated individuals similarly. So when we get the first instance of an employee who has someone from one of the 72 states visiting with them for the holidays, we're going to have to figure out what to do, and then we're going to have to apply it uniformly. In some cases, not applying it uniformly would run you afoul of your collective bargaining agreements anyway, but you do have employees who are not subject to the collective bargaining agreements, and so it's not really governed by the collective bargaining agreements, it's governed more by these cases about treating people similarly. So there may be, as I said, there's so many of these, they're so obvious, these examples I'm giving you, I can just see the half of your faces that I can see, you're like, okay, that makes sense. So I do think it's possible that whether it's the Department of Education, Department of Health, another executive order from the governor, given what we expect to be facing with the holidays and the weather, we may get guidance on it that we don't have right now. So even if I were to answer your question with great specificity in public, which typically I wouldn't do, that answer could change next week. So we have been in communication with your administration here and of course our various clients, keeping an eye on the law, the regulations, the guidances, the executive orders. It's very complicated.
So some get paid, some don't. It's, okay. You don't have guidelines. Well, you must have some kind of idea.
Well, and we have access to Vito's principal attorney, who's been, Ms. Wright, who's been helping us tremendously to make sure we're handling similar situations similarly.
Thank you.
The last thing I have is the monthly HIB report, which is more for the record. You can see in October that there were 0 cases reported or investigated across the bill. Okay, that concludes my report.
Thank you, Mr. Arlington. Okay, we can move on to report of committees, review as resolutions, and board discussion. The first item says review and modify policy 0152, board officers.
Did I hand those out? They're in your packet, but I do have. Sorry, I forgot to hand these out earlier. So while we were reviewing our monthly policy reviews, this one popped up, and I was reading the policy alert, and I'm like, okay, the policy alert and our current policy, or bylaw in this specific case, really differ. And essentially, our existing bylaw on how we elect board officers is not how we actually elect board officers. So our current bylaw, which is the first page here, says that we are supposed to be using a written ballot. Use that as the process for electing it. Now, we've been doing a verbal type of vote. And a roll call type of vote. So I wanted to bring this to the board's attention prior to our organization meeting in January. Hopefully we could come to some type of resolution and pick, if you could see on the second page, you have option 1 or option 2, pick one of those options on how we would elect board members, whether it be a verbal or a written ballot. So I don't know if you've had an opportunity to take a look at these.
We don't want you.
Yes, sir.
So I'm sorry to interrupt. Vincent and I have not talked about this. I've never seen this, I don't think, but I assure you that you have to pick one of the two options Vincent has offered you, because not only don't you do what's in this policy, but if I had ever been here when you did it, I would have told you it's unlawful. So there's a case on this that prohibits what's in your policy here, because if you do it the way it's written, the public would not know how individual board members voted, right? This says you submit it to a written ballot, you give it to the board secretary, he says so many, you know, like it's like the end of Survivor.
Right.
You can't do that. And the difference, if you see in option one, is you would have to sign it. So Vincent says, board member X votes for this person. So you have to change this before January. I don't have a voice as to which option you choose, but you can't leave the status quo. It's not lawful. Thank you.
Fortunately, we've been
We
doing it
haven't been
legally.
doing it.
You have been doing it lawfully. That's correct. If you
Correct.
followed your policy, you would have been doing it unlawfully.
Right, so,
There's a moral in there somewhere. I can't figure out what it is, but
so, I mean, it's really your decision as a board, how you want to move forward. I mean, I could do it either way. It's very easy to do paper ballots as well as do the one that we currently do, which is a roll call vote.
Option 2 is the way we've been doing it, right?
Correct.
I mean, personally, I'm happy with the way we've been doing it. That's just my opinion, so.
Yeah.
I see, yeah, I sent out an email a couple, yeah, yep.
One slows down the process.
It would
adds
slow
an
down the
additional
process.
step.
We take enough
because
time as it is.
Yeah,
It just adds an additional step.
okay. Anyone disagree with staying with, moving to option 2, which is our current process? Okay, then that will be updated for December. Okay, thank you.
Okay. Thank you very much. Let's move on to committees, and first up is Finance and Facilities. Mr. Ladati is absent this evening, but Mr. Ganella has a report
Yes.
to give on his behalf.
Yes, I do. So good evening, everyone. The FY22 budget is starting to move. The administrative setup documentation has been distributed to the leadership team, and the forms are all available to have been distributed to the staff. And I have been in the process of formatting the budget documents in anticipation of the administrator's submission in January. The committee, as we mentioned last month, pushed back the times a little bit to January to facilitate and allow the administrations to have some more time putting together their budgets this year. The solar project that we awarded last month is currently in contract review by our bond counsel and our financial advisors, and we are working with all our partners involved with the ESIP project as well, and hopefully finalizing the project scope sometime over the next couple weeks. As of now, the project size for the ESIP is about $1.3 million. Resolution number 4, some review of some of the resolutions. Resolution number 4, line item transfers. I know Mr. Ladati usually lets you know that there's been no line item transfers that exceed our $5,000. Well, we had 4 of them this month. So I'd like to review those. Transfer number 8054 was a transfer for $7,047 from textbooks to professional development. 8055 was $6,550 from the principal's salary to textbooks. 8057 was $79.50 from professional services for guidance to professional services for educational services specifically for the Goal Book. Transfer number 8061, the amount of $6,400 was from child study team evaluations to professional services and related services for health related services. So those are the transfers that exceeded the $5,000 threshold that had been previously set by the Board of Education. Resolution number 6 outlines some checks that we are canceling that have been deemed stale or old, and those funds will be brought back into our the corresponding accounts as miscellaneous revenues. Resolution number 7 is the memorandum of agreement with law enforcement that outlines how law enforcement and the Board of Education interact with one another. Resolution number 8 is approving the statement of assurance for the comprehensive equity plan programs, basically practices and conditions within the school district. This is achieved through a self-assessment to identify areas in need of improvement and creating a 3-year plan to address them. And finally, I'd like to highlight resolution number 10, which is approving an additional grant from the Union County for COVID relief, which we, in this phase of this grant, we are focusing on distance learning equipment and purchasing additional Chromebooks.
Did you skip number 9?
I might have skipped it because I was just highlighting some. I skipped a couple of them.
Oh, okay.
Yeah. What was number 9? Number 9 was...
Transportation.
Yeah, it was just transportation. Number 9 is transportation contracts, approving transportation contracts. That's all I have to report.
Okay. Does anyone have any questions on finance?
A question, I think it was resolution 4, where you made a plan on transfer, the last one, child study team to something else. Is there like less need for child study team?
Well, we didn't do any, those are for summer evaluations.
Okay.
We didn't do any summer evaluations, so there are more needed for health-related services, so we needed to move the money there, so.
Any other questions? All right, we'll move on to personnel and management. Mr. Haefter?
Good evening, everybody. There are 7 resolutions tonight. Resolution 12 approves the employment of a middle school science teacher. Resolution 13 approves the maternity leave absence request. Number 14 approves the payment of unused sick days for a retiring teacher. Number 15 is approves the employment of paraprofessional aides for the 2020-2021 school year. Resolution 16 reaffirms the use of evaluation system and rubrics. Number 17 is the approvals of athletic stipend positions. Number 18 approves the hiring of substitute staff. And that is it for personnel management. Anybody have questions?
Yeah, okay, on resolution 17, the stipends, what's happening with, if we're not doing it, they don't get the pay or they're getting the pay? I know there was discussion on.
Yeah, so we made progress on that conversation. That has more to do with the assistant coaches, right? Who we said we would prorate their salary.
Yeah.
Based on weeks worked in the event that the athletic season is canceled. And so we're even holding off on them until December because we're still in the midst of figuring out the likelihood of holding winter sports. But these head coaches we're approving as is because the expectation is that they'll work with athletes even in virtual mode if the season is canceled to provide and monitor athletic workouts and progress. And still to provide kids, athletes with those opportunities.
Just thought the governor just canceled all indoor sports, so will that affect some of these, I would guess?
Oh, well, yeah, track, right?
Thank you.
Okay.
Well,
Thank you, Mr.
not
Basketball.
all of them.
Thank you, Mr. Haefter.
Track had the word indoor.
Next up is curriculum and instruction. Mrs. Zimmerman?
That's what I was thinking, outside.
Okay, good evening, everybody. We had a curriculum committee meeting tonight. First off, went over several items with Mr. Arlington. First one being the virtual learning feedback survey that he sent out to parents. Got a lot of positive feedback on that in terms of how they felt the situation was working for their children. The majority of the parents are opting to keep their children in virtual at the switchover point for November. Approximately 20 will be returning at Harding and 20 at Brearley. The numbers are such that they can be incorporated into the current classroom situations without making it difficult for the social distancing for those who are present. We discussed the Chromebook updates, the one-to-one initiative. Currently, all the 4 through 12 students have a Chromebook that they are able to take home with them. And the K through 3 students have one assigned that is kept in the classroom. But if there should be a need for them to go virtual, they would be able to take them home. So everyone in the district is set with a Chromebook. Oh, excuse me, mask is not the easiest thing to breathe through. The tech facilitator. We have a tech facilitator. The first few weeks have gone very well, helping our teachers out, holding sessions to train them in the different technology platforms and apps and things that can be used to help make the learning experience for our students the best it can be. That's been going very well, and the tech facilitator will be holding a parent night session so that the parents can get better acclimated to navigating the Google world for their students to understand what their children are doing at home. We also went over the ELA 3-year roadmap and the plans to deal with our English education courses and how to improve the reading and writing skills of the students in our district. Let me think. One other thing of significance was we were talking about the senior level English class and how the district administrators are looking toward overhauling that program to make it one that will be more engaging for our senior year high school students. We know once you reach that point, many high school students are sort of checking out in the English class department, and it is a required course. You know, it is one of the two that you have to take all 4 years of high school. So they're looking at an overhaul of the English program for the 4th year that will make it more into a sort of a seminar situation where they would pick a course that would run for half a year and then a different one for the second half a year that would focus on different areas of literature, such as social justice, crime and law, psychology and literature, science fiction, contemporary fiction, young adult fiction, different areas like that. So the children will have, students, young adults, will have some input into what they're reading, perhaps taking a deeper interest in it as a result. And then we only have 2 items on the agenda resolution-wise. Number 19 is our HIB self-assessment that we just went over. And number 20 is the September HIB report, which was discussed at last month's meeting.
Any questions from anyone for Mrs. Zimmerman? Seeing none.
No? All good?
Thank you, Nancy.
Try not to trip over the wires.
All right, we are moving on to policy review. Mrs. Braun.
Good evening. We have 2 resolutions for policy and regulations. Resolution 21 is a second reading to adopt 2 policies. Policy 3421.13 postnatal accommodations and policy 4421.13, again titled postnatal accommodations. Resolution 22 is 2 revisions to adopt tonight. First one is mandated policy 2464, gifted and talented students. Revisions include requirements regarding the accessibility and development of the gifted and talented education program. And most importantly, all school districts must have a board-approved gifted and talented program for students in grades kindergarten through 12. And the second is mandated policy 8420, emergency and crisis solutions. It's a new law and requires school districts to ensure that individuals employed in the school district in a substitute capacity are provided with information and training on the school district's practices and procedures on school safety and security.
Any questions for Mrs. Braun?
Just, and maybe someone else can answer, gifted and talented, now it's mandated, I don't quite understand. Did we not, do some schools not have gifted and talented? Well, what is it about, I guess?
Sure. So part of this policy is that a district has to make known. It's like it's entrance and exit criteria that hasn't been part of the law. So we have to make public the criteria we use to give kids access to gifted and talented. That was the major change. We have a board-approved program in place already. So.
Thank you.
All right. Let's move on to old business. Does anyone have anything for old business? Okay, I don't see anyone. Let's move on to new business. Does anyone have anything under new business? No? Okay. Then at this time, I will entertain a motion to open the meeting to the public.
Motion to open to the public.
Okay, I have a motion by Mrs. Zimmerman. I have a second by Mr. Jankowicz. All those in favor, say aye. Aye. Anyone opposed? Okay, the meeting is open to the public. Mr. Ganella?
Good evening, everyone. Public comments will now be accepted. The Board of Education sets a limit for the public to speak at the Board of Education meeting to 5 minutes per person unless prior permission has been granted by the Board of Education for extended time pursuant to Kenilworth Board of Education Bylaw 0167. Members of the public wishing to make a comment can do so by either emailing the board at publiccomments@kenilworthschools.com, publiccomments@kenilworthschools.com, or by calling the Board of Education conference room at 908-931-9696, extension 2325. Once again, 908-931-9696, extension 2325. Comments will be taken in the following order: phone calls, in-person comments, and then email comments. For the record, please include your name and address in all comment requests. Okay, so as we know, there is a delay between the live feed and our actual what we're doing here, our live feed. There's a delay, let's put it that way. I'll say we will just wait a minute or so.
And there is no in-person.
There is no in-person. And as of now, there are no emails either. In honor of Alex Trebek, we should be playing the Jeopardy theme song.
That's true.
All right, that's about a minute and 20 seconds. I think we are good.
Motion to close the public?
Okay, I have a motion to close the public portion of the meeting. Do I have a second?
Motion to close?
Is that Mr. Havether? Yeah, okay. Motion made by Mrs. Zimmerman, second by Mr. Havether. All those in favor, say aye. Aye. Anyone opposed? Okay, the meeting is, the public portion of the meeting is closed. And at this time, we'll move on to our roll call of resolutions. Mr. Ganell.
Okay. All right, we have finance and facilities. We have 11 resolutions, resolutions 1 through 11. Mr. Biner, I think you would like to make that motion this evening?
So I'm moving resolutions 1 through 11.
Yep. Is there a second?
Second.
Sure.
Mrs. Zimmerman? Are there any that need to be excluded prior to voting? No? Okay, so this is voting on resolutions 1 through 11 on the agenda. Biner?
Yes.
Braun?
Yes?
Drogan?
Yes?
Haberther? Yes. Jankowitz? Yes. Panici?
Yes.
Zimmerman?
Yes.
David?
Yes.
Motion's carry unanimously. This is for resolutions, personnel resolutions 12 through 18 on the agenda. Okay, is there a second? Mr. Jankowitz? Okay, this is resolutions number 12 through 18 on the agenda. Any of those need to be voted on separately? Okay, once again, 12 through 18. Biner?
Yes.
Braun?
Yes?
Drogan?
Yes?
Haberther? Yes. Jankowitz? Yes. Panici?
Yes.
Zimmerman?
Yes.
David?
Yes.
Motion carries unanimously. This is curriculum and instruction resolutions 19 and 20 on the agenda.
Move those?
Okay, is there a second?
Second.
Okay, seconded by Mr. Biner. Okay, any of those need to be voted on separately? No? Okay. Resolutions 19 and 20 on the agenda. Mr. Biner?
Yes.
Braun?
Yes?
Drogan?
Yes?
Haberther? Yes. Jankowitz?
Yes.
Panici?
Yes.
Zimmerman?
Yes.
David?
Yes.
Motion's carry unanimously. And policy resolutions number 21 and 22.
Make a motion to move resolutions 21 and 22.
I'll second that.
Okay, seconded by Mrs. Drogan. Okay, any of the resolutions 21 or 22 need to be voted on separately? None? Okay. Okay, Mr. Biner?
Yes.
Braun?
Yes?
Drogan?
Yes?
Haberther?
Yes.
Jankowitz?
Yes.
Panici?
Yes.
Zimmerman?
Yes.
And David?
Yes.
Motion's carry unanimously.
Okay, we are up to executive session, and it looks like we have agenda item to discuss KE negotiations. Is that correct? Mr. Ganella?
We don't need to do that now.
We do not, okay.
No, we do not.
That sounds great. All right, then I
Motion
guess
to
at this
adjourn.
point, I'll entertain a motion to adjourn.
You got it.
Okay.
Mrs. Zimmerman? Okay, a motion by Mrs. Zimmerman, second by Mr. Havether. All those in favor say aye. Aye. Anyone opposed? Okay, meeting is adjourned. Thank you, everyone.
Good night.